Why this story matters. While challenges remain, stories like this demonstrate that constructive action can make a real difference. Quick summary: this story highlights recent developments related to mental health, showing how constructive action can lead to meaningful results. ON weekday evenings between 6 p.m. and 10 p.m. PSD, the small, softly lit teen line office in Culver City, car begins to buzz. A handful of high schoolers, many still in their school sweatshirts, settle into cubicles, put on headsets, and begin answering calls, texts, and emails from other teenagers who need someone to talk to. For more than 4 decades, Teen Line has been demonstrating the power of a simple but radical idea that sometimes the best person to talk to about teenage problems is another teenager. Founded in 1980 as the Center for the Study of Young People in Groups, the grassroots nonprofit evolved into a vital resource for young people struggling with stress, loneliness, relationships, and mental health challenges. Today, it operates as part of Diddy Hirsch Mental Health Services, home to the nation's first and largest suicide prevention center, which served more than 235 individuals in 2010. Teen Line still runs on the same core model, trained teens supporting peers through non-judgmental listening. I think the biggest thing I say to almost every caller is that it's okay not to be okay, says Sanaya, a soft-spoken volunteer who joined in fall 2024 and professed to only give her first name. There's such a culture, especially among teenagers, to just say, "I'm fine." But by reassuring them that it's really okay to talk about what's going on, people start to open up. Then we can have a much deeper conversation. Would you like to read more good news about mental health, students, anxiety, and teenagers? Teen Line's mission feels more critical than ever. Approximately 40% of US high school students report persistent sadness or hopelessness, and suicide remains the second leading cause of death for youth ages 10 to 24, according to the CDC. Teen Line fills a widening gap in the nation's fraying youth mental health system with no federal funding, only grants, donations, and the dedication of 100 teen volunteers who log more than 10,000 contacts a year from youth around the world. We even once got a call from a teen in Zimbabwe who found us online, says Cheryl Karp-Eskin, the organization's senior director. Approximately 100 teen volunteers log more than 10,000 contacts a year from youth around the world. Photo courtesy of Teen Line. Meanwhile, major funding streams for school-based mental health support have been cut. The U.S. Department of Education recently ended roughly $1 billion in grants originally designated to help schools hire additional counselors and psychologists under the 2020 Bipartisan Safer Communities Act, passed after a wave of school shootings. Simultaneously, the federal government has removed the dedicated press-to option for LGBTQ youth on the National 1988 Suicide Crisis Lifeline. At a time when youth mental health needs are escalating, federal support for key programs is shrinking. That makes Teen Line's peer-to-peer model all the more essential. Volunteers like Sanaya must be at least 14 years old and complete a rigorous selection and training process before taking their first call. It starts with a written application and then interviews, she explains. If you get accepted, you get about 3 months of classroom training, where you learn about the various topics. You could be covering anything from bullying to eating disorders to suicide and how to manage those when you're on a call. We also learn active listening and ways to make people feel heard. That training includes practice calls, guest speakers from organizations like the Rape Treatment Center, and lessons in emotional regulation and crisis response.
Only after completing this curriculum do volunteers begin answering emails, then texts, and finally phone calls.
Sunday usually takes about 1 shift a week, more than the minimum commitment of 2 shifts a month. It's definitely one of my favorite things to do after school, she says. I love meeting all of the people that work there. We share a lot of the same interests, and I've made some really close friends at Teen Line. According to Eskin, about 60 to 70% of contacts come through online channels, text or email, and all are anonymous and confidential unless someone's safety is at risk. When the Teen Line office closes at 10 p.m., trained adult counselors at Diddy Hirsch pick up the phones as part of their shift on the National 988 Lifeline hotline. We're not anti-adult, Eskin says with a laugh. But often the adults in teens' lives are the ones grading them or disciplining them. That power dynamic changes everything. When you're talking to another teen, it just feels simpler and safer. Eskin would know. She was once a Teen Line volunteer herself in high school and has been involved for more than 15 years. Over that time, she's seen social media, smartphones, and the pandemic reshape what it means to be a teenager and how vital empathy has become. Being a teen today is a lot, she says. The pressures of school, social media, and just being constantly connected, it's no wonder anxiety and stress are among our top issues, along with relationships, depression, and suicides.
But what's hopeful is that teens want to help each other.
And when they do, it works. Indeed, Teen Line's impact data show that 98% of callers report finding their interaction helpful, and many reach out again or recommend the line to friends. Some even wrote back months later to say the call saved their life. For Sanaya, the experience of listening has been transformative. I joined at the beginning of my sophomore year because I wanted to make an impact in my community, she says. A friend had used Teen Line and found support, and I wanted to be the person for someone else.